Hi there, I'm Dr. David. I'm 60 years old, and for more than 2 decades, I've worked with patients of all ages, from teenagers to those in their golden years. Magnesium is powerful, but like any good thing, it's all about balance. Many people take it hoping for better sleep, less stress, or more energy. Yet few know that the how matters just as much as the what. In this episode, we'll talk about how to use magnesium safely, the right dose, the best forms, and the simple habits that help your body hold on to it naturally. Because with magnesium, less but right is always better than more but wrong. If this topic resonates with you, don't forget to like, share, and subscribe for more science-based health insights. Safe ways to use Magnesium 1. The safe daily dose. I often tell my patients, with magnesium, less but right is always better than more but wrong. The human body only needs a small amount of magnesium each day to keep your heartbeat steady, your sleep deep, and your mind calm. A safe daily intake usually ranges from 100 to 200 milligrams and should not exceed 350 milligrams unless your doctor specifically recommends it. Think of your body as a glass of water. Once it's full, adding more only makes it overflow. Magnesium works the same way. Many people assume that more means faster results, but exceeding your limit can actually slow your heart rate, lower your blood pressure, or even cause toxicity. Start low. Give your body time to adjust, because good health isn't about adding more, it's about knowing when to stop. 2. Start low and increase gradually. I always remind my patients, never rush when starting magnesium. Each body absorbs and reacts differently. The best way is to begin with about 100 milligrams per day and observe how you feel in the first few days. Do you sleep better? Feel calmer? Or do you feel sluggish or unusually tired? If everything feels stable, you can slowly increase to 200 milligrams or slightly higher with your doctor's approval. But don't rush. I've seen people double their dose after just a few days, hoping for quicker results, and end up with nausea, diarrhea, slow heartbeat, and that drained, heavy feeling like all energy has been pulled out of them. Your body isn't a machine. It's a living system that needs to be listened to. So go slow, stay patient, and let your body tell you when enough is enough. 3. Choose the right form. Glycinate or malate? If you ask me which form of magnesium is best, my answer is simple. Choose the kind your body can actually recognize and absorb easily. Among the many types available, magnesium glycinate and magnesium malate are the top choices. They're gentle on the stomach, highly absorbable, and rarely cause side effects like diarrhea or cramps. I often recommend glycinate for those with anxiety, tension, or insomnia. It's calming and soothing. Malate, on the other hand, supports energy and helps reduce fatigue. I like to joke with my patients. Glycinate is your evening tea, calm and relaxing. Malate is your morning coffee, light and energizing. Both have their place. It just depends on what your body needs more. And please don't choose a supplement just because the label says faster absorption or double potency. In medicine, the right one is always better than the loudest one. 4. Watch for drug interactions. Here's something many people overlook. Not all magnesiums are created equal. You'll see labels like oxide, citrate, glycinate, malate, but each one behaves differently inside your body. If your goal is simply to relieve constipation, magnesium oxide might work since it draws water into the intestines, but if you're trying to support your heart muscles or brain, oxide won't help much. It's poorly absorbed and mostly flushed out. I once had a patient who said, "Doctor, I've been taking magnesium every day, but still have muscle cramps and insomnia." She was using magnesium oxide, a form that basically passes through the body. So remember, choose wisely based on your needs, not the marketing. Key principles. 1. It's not about adding more, it's about keeping balance. I often tell my patients, taking magnesium isn't just about adding, it's about learning how to keep it. Magnesium works in harmony with other nutrients like vitamin D, calcium, caffeine, and alcohol. Too much vitamin D or calcium without enough magnesium creates imbalance. Muscles tighten, the heart races, and the nervous system gets overstimulated. On the flip side, caffeine and alcohol quietly drain magnesium from your system. You could take supplements every day, but if you're still drinking 3 cups of coffee in the morning and a glass of wine at night, your magnesium won't stay long. So the first rule of using magnesium: effectively control what takes it away. Sometimes the best way to restore balance isn't to add, but to protect what you already have. 2. Blood tests don't tell the whole story. One surprising fact: blood tests don't truly show how much magnesium your body has. I've met many patients with normal magnesium levels on paper who still suffer from insomnia, cramps, anxiety, and fatigue. That's because over 99% of magnesium lives inside your cells, not in your bloodstream. So your blood can look normal while your cells are running on empty. That's why I tell patients, don't rely only on numbers, listen to your body. If you constantly feel tense, can't sleep, or get muscle cramps, your body might be telling you it's low, even if your lab results say otherwise. Science measures numbers, but only you can feel what's really happening inside. 3. Combine with healthy living, don't rely on pills. No magnesium pill can replace a healthy lifestyle. Supplements are easy. What's harder and far more important is how you live every day. What you eat, how you rest, and whether you give your body time to breathe. I once had a patient who took magnesium daily faithfully, yet she was still exhausted, anxious, and sleepless. She worked 12-hour days, skipped breakfast, drank endless coffee, and never paused to relax. Her problem wasn't magnesium deficiency, it was life imbalance. Magnesium only works when you also nourish your body with real food: leafy greens, nuts, whole grains, and fatty fish. When you sleep well, reduce stress, and take time to unwind. Because magnesium doesn't just feed your muscles, it feeds your sense of calm. Don't expect a single pill to heal everything. Sometimes what your body needs most isn't more, it's less tension. Remember, taking magnesium isn't just about popping a pill. It's a journey of understanding your body, your lifestyle, and learning how to restore true balance. When used correctly, magnesium can help you relax, sleep better, ease muscle tension, and keep your heartbeat steady. But if used the wrong way, it can do the opposite. So start low, go slow, and always listen to your body before trusting any label. If this video helped you understand magnesium better, don't forget to like, share, and subscribe to support the channel, so we can keep bringing you more clear, science-based, and practical health content. In the next video, we'll explore the connection between magnesium, calcium, and vitamin D, and why an imbalance among them might be the real reason behind your fatigue, cramps, or insomnia. Stay tuned. Your body will thank you for it.